Hi everybody, thanks for joining us. For those of you who don't know me, my name is Peter Llewellyn. I run the services at MedCommsNetworking.com. So information services resources for the global MedComms community, by which I mean medical communications, medical education, medical publishing, people who work in and around those businesses. So you find lots of resources at MedCommsNetworking.com. We're running these webinars at the moment. We've been doing so for some time, and it's great because we can involve people from all over the world. We've got a good audience in today, and our panelists. I'm delighted to see the team here from Prime Global, who we'll introduce in a moment. You'll find that we record these videos, webinars, and we put them on NetworkPharma TV. So there's loads now. There's 350 plus videos there if you want to catch up on what we've done before. And we're running these webinars at the moment every Wednesday. So you'll find the details at medcommsnetworking.com. So thanks very much for joining us today. Absolutely delighted to have the guys here from Prime Global. We've got Jen and we've got Sue and we've got Michelle, and I'm going to hand over to Sue to start with a little presentation discussion. Please, members of the audience, remember we're going to have opportunity for Q&A. So you've got a chat box and a Q&A box. Use those to text in any comments or observations, questions that we can weave into the discussion. So on that note, Sue, over to you.
Hi, thanks a lot, Peter. Great to have opportunity of meeting with you all today on the webinar, and we are going to run it as a bit of a chat. So just to start off with, let me introduce myself. So I'm Sue O'Leary. I head up the market access team at Prime Global. I'm a pharmacist by background, spent time in the health service and plenty of time in the pharma industry, and now consulting as part of Prime Global. Enough of me, over to my team that I work really closely with. So Michelle.
Hi guys, I'm Michelle Collins. I'm a digital strategist here at Prime Global. I've spent the last 10 years working within the industry in mainly med affairs, and 6 years before that in the consumer industry. So really looking forward to having a really fun discussion today.
Thank you, Michelle. My name is Jenn Blackham, and I'm the VP of Client Partnerships. I support Prime Global's 7 agencies and 5 consultancies with business development and partnerships. And my expertise is in the payer space. So I've been in this space for over 12 years. So I'm really looking forward to this conversation today about what's changed and what hasn't changed. I'm going to turn it back over to Sue.
Yes, thanks both. So just by way of scene setting, this session is entitled "The Digital Payer Fact or Fiction," and we're gonna present sort of both sides of that and see where we land. And actually, then very interested in some of your views. So, just by way of scene setting, the MedComms space at the moment is absolutely awash with talk about digital transformation, moving to disseminating data in new innovative ways, podcasts, webinars, gamification, social everything. But let's be honest, I've worked in the payer space for a long time, and you know, the market access deliverables and all of the evidence dossiers don't naturally lend themselves to some of these communication vehicles. So I don't actually believe in this transformation. We're going to be throwing away the dossiers and moving on to wholesale different formats. I'm not sure that the world's ready for it. I'm not ready for it. I'm not quite sure the world's ready for it. But I think what's really interesting is that evidence is key in the payer market access space. And I want to explore a little bit more how, keeping that in mind, we can move forward. So I see maybe a little shift, a transformation, maybe not. So let's talk a little bit more around sort of this cosmic shift that we're seeing in the digital space. Michelle, you see me as one of life's laggards on technology. I know that. So as a digital strategist, sort of talk me through, give me a little bit of your own view about, you know, how this is moving.
No worries, Sue. Yeah, as I said, I've been in the industry for 10 years, and the rate for digital adoption has really accelerated within that time, especially amongst HCPs and patients. And this is when we look at all of our audiences, it's really, there has been an acceleration due to COVID-19. As we're all aware, we've had to move offline to an online format. And when we look at where we've come from in the last few years, so if we just have a look at a slide. here. So in terms of that rate of adoption, and in terms of the channels that have been introduced to our world in pharma, the first blog was launched in 2005. As you'll see here, we have really, as an industry, we have embraced digital and online formats, and there's new channels launching every day. In particularly when we look at, for example, Clubhouse, as we all know, and also we look at Twitter. And that's something that's really been embraced in terms of HCPs. That is a real hotbed for peer-to-peer conversations. So when we look at these channels here, it's really important that we take a step back and think, how can we reach our audience? So we're reaching them on the right channel at the right time, but doing it in a compliant way and a way that our audience feels comfortable. And one thing that I think would be interesting to know is how we can do this with our payers. And this is something that we've got great experience with in the last year or so in terms of engaging payers within this environment.
So Michelle, how does all of this, I mean, you talk about Clubhouse. I hadn't really heard of it before. Talking to me about it. You know, how is all of this going to translate into the payer space? I mean, let's go back into that whole world of evidence-based medicine, everything set up with templates and structures. And I'm just thinking about how we communicate with our reimbursement authorities and health technology bodies. Possibly not quite ready for some of this, but what's your view on the payer space?
I think within the payer space, so I personally, and I think as a group, we probably agree on this, that it hasn't accelerated as much as it has for HCPs or patients. However, I do feel in terms of the payer space, in terms of these channels, something that we've got experience within our projects is LinkedIn, in terms of engaging payers for disseminating content to them, and that for us is a channel that they feel more comfortable as opposed to Twitter. Okay,
no, thanks, Michelle. So I want to bring you in, Jenny. You know, you're based in the US and you've been discussing both firsthand with payers and also with pharmaceutical companies around communicating with impact. Just tell me whether you're seeing from a US perspective that sort of same adoption and how also that relates to your European experience in terms of payer comms.
Yeah, definitely. Thanks, Sue. So we are not seeing the same rate of adoption in the payer space like we're seeing with HCPs and patients that Michelle just spoke about. However, we are seeing some movement, and this movement actually has been confirmed in a recent study that we did with 40 global payers. And I would actually like to share some of our results from this research. So we did an online survey to gain insights on payers' behaviors and preferences for digital media now and in the future. And what we found was that the majority of the payers reported very high comfort levels in using digital media for professional purposes. And as a result of fewer face-to-face interactions, over 50% said that their comfort level is actually increased. Next slide. So as I mentioned, we wanted to understand what's happening today and what's happening in the future. So what we learned is that payers are receiving a variety of evidence from the industry. And they're receiving this evidence in a combination of traditional, so the PowerPoint and the publications, but also digital, which we define as short video and podcasts. And when we went a little bit deeper and we asked, well, is the digital format effective and impactful in your decision making? And again, the majority of the payers said yes. And they said yes for the reasons why, right? They said because it lets them access information on the go. It helps them learn new information, also reinforces information. So for me, I would say that the digital payer, it maybe is a fact, But as Sue just showed to the next slide, I think there might be a plot twist, right? Because when we asked about the future, they actually wanted a range of communication platforms. So they didn't just want traditional, they didn't just want digital, they wanted them both. And so one of the key messages that we found from our research is that we do need to provide a mix of the traditional and the digital in a multi-channel approach. And this is how we've been supporting our clients in the last year.
Thanks, Jenny. So just to sort of come back on that, thank you for sharing that information. So I think, you know, what I'm hearing you say is that there is opportunity, but that payers do like that purity of evidence and that link back to the publications. And I think that sort of fits in with my experience of talking to them. They want to see the purity of evidence. They're really, you know, sound bites are okay, but when you present an extract, a sound bite, they always want to go back to have that link in. So I think we just need to be sort of wary of that, or observe that, and that isn't, you know, from my perspective, that's the fact. Payers need to see that.
Yeah.
And what's your thought about that?
Yeah, definitely, Sue. That came out in our research too, was about the importance of the data. The data needed to be published, if not published, data on file, right? But they definitely preferred the former. And if we are creating those short videos or the podcast, that we really needed to link it back to that source of evidence, with the exception of a patient voice, which, you know, is really about that real unmet need that comes directly from the patient. As I mentioned, this was a global study, and we actually saw some nuances between the regions. And I'm not going to go deep into this because we're really focused on digital. I think that will be our next webinar. But we saw that in the EU region, behind clinical trials, the payers wanted more real-world evidence and HEOR. Where in the US region, behind clinical trials, they wanted the unmet need and also burden data. So there is that slight nuance that we need to take into consideration when we're working with our industry, payer access and payer market access and payer evidence teams. Okay, no,
Thanks, Jenny. So there's sort of a place for innovation, but we have to get it into the right space. Michelle, you know, your background, your experience is more in that physician transformation. You know, you're also working on the payer space now. How does what's being described relate to what you're seeing with physicians, and how that's moving, engaging?
I think the commonality is that data, the purity of evidence that you're talking about, Sue, in terms of physicians aren't different in terms of when they want to get knee deep in that data, they want to interact with that data. So for example, a podcast wouldn't be applicable in as a source if we're talking about data, and we really want to get our physicians interactive and immersing in that data. So what we really need to look at is the story that we want to tell, and then understand what format is right for that right person, and also really understanding how we can reach that person. And I think when you look at physicians versus payers, I think one of the clear things is payers in our experience are more comfortable in an environment like LinkedIn as opposed to Twitter, but also where Twitter is that hotbed for peer-to-peer conversations for physicians, it's not the case for payers. And there is that question, is where is the actual payer home? Is it on LinkedIn? We found it very successful in previous campaigns. However, I think what would be really interesting is to see how that payer environment evolves, because as Jenny said, the payer environment is becoming more and more comfortable with digital formats.
Yeah, I do think, you know, in the future we will have a digital home for the payer, but, you know, stay tuned on that.
Yeah.
Okay. No, thanks for that. I want to shift a little bit, because you know, we talk directly to payers, but also a lot of the communications we have are with global pharma companies, a of time talking to affiliates, and
Yeah.
in my experience, that whole communication between global and affiliates is also open to, you know, dipping toe in the water with new technologies. I think a lot of people in countries now have to get their heads around a lot of new technology, complex brands that are coming up, new types of therapies when they're working across portfolios. And I'm just been sort of thinking a little bit more about, you know, my time in an affiliate and how those technologies might be more helpful in that perspective. So Jenny, I know you've been on the ground a lot talking to people. What's your thoughts on that?
Yeah, so the narrative is definitely changing with the industry. You know, when I think about when I started my career in the US as a field associate on a payer team, and then, you know, talking to multiple affiliate groups in consulting over the last 12 years, you know, digital was not part of our lexicon. It was not even a word that we talked about, right? But now it's becoming more prevalent, and it's actually coming up in every single meeting we're having with our clients. And, you know, Sue, you mentioned earlier about how we as market access and payer evidence teams are required to use these structured templates for launches, you know, the AIMS fee dossier or a nice mission or another HTA requirement, right? So the written resources that we currently do for our teams, they need to stay because they help the affiliates do their job effectively in a compliant way. So that's not going to go away, at least not now. However, where we're seeing that shift in the digital conversation is helping the affiliates prepare for payer conversations. This is currently happening, you know, like on Zoom where we're at today. You know, these affiliates are, as you mentioned, are covering multiple disease states. They can be covering up to 5 to 6 drugs, and they need to be able to articulate the value story, what differentiates the product, and being able to really articulate the nuances that you might see with the MOA or the study design. And what we've found is that digital component, having them listen to the unmet need or the burden, or see that short video where they look and see the MOA and how it works, actually gives them more confidence and effectively equips them to have more impactful payer conversations. So that's where we're seeing the digital come in with our clients.
No, that's clear. I mean, you know, some of the new drug advances, there's a lot of complex mechanisms. There's a lot about targeted therapies, and I think that they are difficult to write in a paragraph of text to understand what it actually means. I look forward to the day when we can actually present videos at a technology appraisal committee or that sort of you know, voice of the patient type. But I think that's not quite there yet. But yeah, no, I see your point within the sort of training and learning and development.
Yeah.
Michelle, I think you know, you've definitely, I've seen some of the learning tools that you've been doing in the medical affairs space, and some of that sort of transformation that's going on. That's what I wanted to enhance as well for payers. But what's your thoughts on that sort of tools and learning and the learning and development side?
Thanks, Sue. Yeah, no, I think when you look at training from a digital lens, I always like to keep things simple, and I always have. When I'm looking at training, I like to have 4 key principles. And the first one is really simple in terms of keeping that user in mind. So what we need to do is, before we create this great e-learning or training strategy, we need to approach the affiliates and really understand what works for them. Then the second thing is really ensuring, when we're looking at, especially online, that we're keeping it simple, engaging, and interactive. And then the third thing, and I think it comes back to what we've been saying here on this webinar, is that purity of evidence, making sure that it's scientifically credible. And then the fourth one is ensuring that we have robust KPIs assigned to these digital e-learning or digital training tactics to ensure that we're continuously looking at what's working, what's not working, so we can work agilely and then use them to inform future strategies.
Yeah, no, that makes sense. I mean, because this is an investment. I mean, moving things to digital is an investment, and I think everybody, whatever the setting, wants to know that if they're going to do this creation and they're going to, we've already said you need to have the traditional, so this is kind of like an add-on, and we need to be able to measure, and we need to be able to sort of validate that success. So thanks for that. Jenny, just in terms of some of the delivery and some of the podcasts, I know you've been looking at podcasts and recording and voiceover things. What's some of the activities that you've done that have resonated well when you've taken those out to companies?
Yeah, definitely. Well, a few topics come to mind. As I spoke already about, is the MOA is a great way to, it's a great topic to use in short videos. Even talking about how your MOA is different than your competitors, right? We do a lot of work in oncology, and oncology is becoming a crowded market. You need to be able to differentiate, and MOA is a great way. Also, a study design. Again, they're getting way more complex. When I started in the industry and without talking about study designs, they were very simple. Now they're definitely not simple. So those are two different topics that we're using a lot with our clients.
Okay. And Michelle, patient voice has become a big thing, both within Proud Global, but also within the payer space. There are more opportunities to get that sort of burden and unmet need into that whole value story. What's your view around how to capture that sort of patient voice into sort of market access?
Yeah, and I think that's where looking at that patient voice, it can be done through a short video where a patient talks about their burden of illness, but also I think what's really nice for that patient voice and effective is actually a podcast where they can talk about that burden of illness. And the good thing about podcast is it's something that a payer can listen on their commute into work or while they're walking the dog, etc., where they don't really need to get in deep into the purity of evidence. It's something like that they can listen to, and I think that's where we need, when we're bringing it back to what I said earlier, is we really need to understand the story we want to tell and then selecting the right format. But podcasts are a great way of bringing the patient voice to the payer.
Yeah, and just I want to add on that, when you actually hear a patient talk, it brings out that emotion, right? It really brings out the light of what's happening versus reading it in a publication. But you can show that what's going on with a patient and it's also being published. I think that actually builds even more, has a more impact when you go out and talk to the payers.
Definitely.
Yeah, and I've seen, I'm thinking as you're talking around, I've been to a few HTA advisory boards, and I have seen how when any patient representative there, that it actually changes the whole sort of feeling in the committee. They might have been looking at numbers and data, and suddenly you have a patient perspective, and it does change things. So it's it's how to harness that in a way that you don't have to have the patient in the room, because obviously that's challenging for a lot of committees, and across the globe it is varied. I mean, we are seeing the patient perspective taken more and more into account in value decisions, but it's not universal, and I think it's picking out the right places. I'm conscious for time, and I do want to have a discussion. There's one more topic that just to ask you. You quite often talk about gamification, and I'm kind of like the other end of this being something that is of interest to market access teams or to peers. But
maybe you are a laggard, Sue.
I am a laggard. So let me I should let you have your. For me, it is fiction. Right, fact that's going to make me believe that gamification is happening in our space. Jenny, go for it.
Yeah, so you are a laggard, Sue. I hate to say it. But we are actually having conversations with affiliate teams on gamification. So they are saying this is a great way not to teach the science, but to help the affiliates enforce what they have learned. It helps them be able to recall the key data points from objection handlers, which we all know are very important, because the payers, they always have tons of objections when you're trying to get your drug approved or, getting access for the patient. And, end of the day, we're all here to help patients. And then also have a little fun. Who doesn't like a game?
Michelle, anything to add from that, or are you stuck for words?
No, I'm never stuck for words, am I, Sue? No, I think from our experience, we know gamification works for communicating with the affiliates, because it's back to that second point I mentioned earlier in the 4 criteria. It's immersive and interactive. It keeps our audience engaged. When we're, as we all know, we're overwhelmed with the amount of information in front of us. So this is really something that can be a little bit different but fun, to Jenny's words. And also it's something that we've seen that's also worked within our HCP environment, especially our Congress. HCPs love a game.
Okay, so no, thank you both. I'm just going to really wrap this up now so that we can move on. But I think what we've heard and what we've been talking about, and we do have different perspectives, and that what to go to work is that we have the traditional, and the traditional is going to stay. It's definitely in the payer and the market access space, but that actually, as world is transforming, there may be opportunities. We may be able to append a podcast to our HTA submission.
Yeah, that'd be great.
Or things in the future. But at the moment, we're going through this transition, and that actually we could try things out with some of the more affiliates that maybe are having that dialogue, that want to test things out. And certainly in that sort of training cascade. But I mean, I think, keeping that link to the evidence base is going to be key on anything that we do moving forward. So no, thank you all for that. I think we've got some time, Peter. I've been trying to keep an eye on the questions, but my multitasking has stopped.
Don't worry. I found that fascinating, actually, for several reasons. And forgive me, because I might be a bit rude at a couple of points in this now, but I thought that was a fascinating discussion. And so before I leap in and with my 2 big boots, just a reminder, obviously, people in the audience who are online today, please, you've got a chat box, you've got a quiz, a Q&A box. Put your comments and observations and questions in, and we'll try and weave that into the discussion over the next 10, 15 minutes or so. I wonder where to start. One of the things that struck me right to begin with was, crikey, because you're very enthusiastic about this, sort of like how MedComms is doing everything digitally, and yet the payers are behind. And I suppose I'd be one of the people that says, crikey, MedComms have still got a way to catch up. And yes, we've accelerated in the last 18 months. But so I found that just very, very interesting. And I've not really thought about it very much, and I don't have that much direct contact with it. So the payers, from what you're saying, payers as a group are even behind, HCPs, MedComms, whatever. And and I know you said I think part of your argument was they like that evidence base, they like the purity of evidence and so on. But there's nothing to stop you providing purity of evidence digitally. And I think, Michelle, you were saying a bit like with the HCPs, they want the data and so on as well. So it can't be as simple as that. Have you got any more reflections on quite what makes them so different to the HCPs?
I think, yeah, Peter, I think there was a question somewhere in there. I'll try and answer it in a way. So I think a couple of things sort of come to mind. I wouldn't like to collectively bucket payers. I mean, they are not a homogeneous group in the fact that they don't like digital. I think what is common amongst payers is that they are all tied to a process and a structure, and the current changing processes of assessment takes time, and evolution is really slow in that space. So I think some of the methods that payers have to work within are still quite traditional. I'm trying not to work out my words here. So even though you might have individuals there, they're sort of in a system that maybe doesn't enable that. And then I think moving forward as well, there's much less opportunity for affiliates to have that face-to-face communication than maybe historically. So the opportunity to maybe try new things, and there are sort of liaison people that go out still with technology that they can share, but that really does vary. And I think we're seeing like compliance in all of the countries is all a bit different. So it's quite difficult to roll out if you're sitting in a European global to say, you know, go out and talk to your payers in Germany, UK, France. People will just go, we can't. And so I think that the reason is there is that sort of constraint at the moment. It's not quite as free in terms of the conversations. People are cautious. When we try and recruit payers for research, there are a lot of compliance hurdles.
Yeah.
Through. It is just not such an open dialogue. And I think that is why we see that difference.
Okay.
I like evidence. If somebody tells me something's black, I want to check it's black.
Yeah.
Okay.
And also,
Go on, Jen. Sorry, Jen.
They don't always trust the industry, I think, as much as HCPs. So, you know, one of the things that came out in the research was like, you know, we don't always know what's being put out on the social media is really not biased, or if it is really, you know, published data. So, you know, sometimes they question the source, and they sometimes also like to do their own research, and they have their own internal groups. They just, their roles are very different than the HCPs too.
Okay.
Michelle, have you got a view on that? Am I leading? And then I'll say what I think. Are you going to add anything to that?
No, I think from the payer's perspective, Sue and Jenny have covered it really well. Again, to Sue's point, where it's not a blanket approach, we definitely do believe that payers have different levels of rates of adoption for digital for different reasons, and the same way as HCPs do. But what really interested me, Peter, was your question on us as an industry and our rate for digital adoption. I personally think that in terms of where we've come in the last 18 months has been amazing. And I think with the resources that we have available and the minds that within our industry, I think we can go even further. So I'm really excited what the future is going to have. And I do hold my hands up and think that, yeah, of course, we are behind certainly in certain aspects to other industries, especially the consumer facing industries, but we've definitely got the more resources to really push ourselves further. So it's going to be a really exciting time for HCP patient and payer engagement in a digital environment.
Yeah, no, and I completely, I mean, I said it's accelerating in the last 18 months, and it is very exciting, I think, what can happen. But it is part of this sort of discussion hinges on what we mean by digital. And I thought, and correct me if I'm wrong, because I thought that was slightly odd if I was honest, in the survey that you were doing, you seemed to say that you define digital as podcast and video, and the implication was short video, which seems a very, very specific definition of digital. And some of what you've been talking about sounds a bit like you're talking very much about sort of social media, you know, saying little bits on Twitter and whatever, which, and I would say, well, digital's way bigger than that. So I just want to be a little bit clearer on that aspect of it, if I can ask.
Yeah, I can take that on since I led the research. So to your point, Peter, digital is such a big word and it means different things to all people, right? So we had to define it to really help us guide the results, like, you know, to help the payers understand what we meant by digital. So with formats, we define that as short videos and podcasts. And when we talked about social media, it was, you know, LinkedIn, Twitter, Facebook, Clubhouse, you know, TikTok. Believe it or not, it's happening in the medical community. And as Michelle said in her, when she was speaking, is that they did prefer LinkedIn the most out of all the different social medias. And as I mentioned before, they just, you know, they said in the research is that there's not a consistent social media channel that they can go to and get reliable published data. So I think we have some room to grow there, but you know, positive, at least they acknowledge that, and you know, they are using social media to get some kind of information.
Yeah, okay. And the LinkedIn point also intrigued me. And you're talking about LinkedIn as a favored social platform, and you're implying that you run some groups on LinkedIn, a closed LinkedIn groups on. Is it LinkedIn is the preferred platform, or is it that was just a very quick and easy way to set up a closed group, and actually it's the closed group bit of that works? Well, it could be on a completely different platform. It's just put them into a closed group and they just feel a bit more relaxed and open up.
No,
so I mean,
yeah,
no,
I
really
think
LinkedIn.
Yeah, no, yeah, it is true. LinkedIn is, I think the thing with LinkedIn is what we've really used it for, Peter, is that dissemination of content and how to reach payers. Because with LinkedIn, it's got really great targeting abilities where you can target basically on their profession, but also their location. So that's where LinkedIn worked really well. But also when we, and to Jenny's point in the survey, that's where payers are actually preferred to interact with content, is because they're probably more on LinkedIn versus Twitter.
And just
Okay,
really
just
to
again,
add on that.
Sorry,
Yeah, I just add on that. I read some of the verbatim from the payers because I'm detailed. And they see LinkedIn as a professional network, that it was repeated several times when we gave people free text opportunities. They so payers were, you know, it was an astounding like 0 on TikTok, and like just off the, you know, 1 or 2 would consider Facebook. It was so distinct that they see some as professional and some as not, and I don't think it was quite black and white. You didn't have to interpret with much.
Okay. I find, and I don't know the answer to this question. Just to finish my question, is then I just literally don't know. Is there not a payers closed community platform out there in the way that you do with HCPs? Is that just a gap in the marketplace?
Jenny, I'll let you answer that because
I ask that question every day. I'm like, why is there not?
Okay.
We have an HCP site, we have a patient site. Why is there not a payer site? And I don't know the answer to that. When I bring that up with our teams, no one really can answer that question. So I think that's a gap in the market.
Okay, which is interesting. I was hesitating there because I just thought I'm going to be told I'm being really stupid here, but that's an interesting point in itself. Okay, let's see whether we can pick up some of the questions that have come in. I'm going to leave the patient voice slightly to finish on. We've got a whole bunch of questions about patient voice importance, which maybe slightly is a different point to what the bulk of this was about, which was digital or digital activity with the payers and so on. But let's come back to that. Yeah. I think George is coming out. Do payers need to come out and provide guidance on how the digital materials should be produced? I presume you do get payers involved in the sort of development of these sorts of projects? Is there more room to get them more involved in directing what we do? Is that a sense? That seems like a sensible comment. That's just a yes from everybody. Yeah. Okay. Good. Okay. Yeah. Right. Let's keep moving. So we're talking about if you're in. Okay. So there's a question from Susie. If you're in a market research globally, would you spend money on delivering payer tools in a digital format? Which I suppose gets to the heart of this. You know, are you however interested? Is it a waste of time because they're not actually doing anything except on LinkedIn? Or I'm being slightly flippant there, but what's your answer to Susie there? And talk about, how, would you be pursuing this actively? Are they just slow, or are they going to be very, very slow to adopt these sorts of activities?
Jenny, I mean, we're quite often asked this, is that worth the investment? And I think, Peter, you asked about why we picked out podcasts and short videos, and the reason is that is the most sort of tangible for companies at the moment to be dealing with, because it hasn't gone the whole sort of way into a full transformation. But Jenny, just tell me around, if in terms of bang for your buck, what would you be doing if you wanted to dip your toe in the water in the digital space for payers but you have to go up and present it to management as to why you think that way.
This is a daily conversation I'm having with the clients that we work with, is how do we help them show the return on investment, right? And how do we help them be effective in investing in digital? And we always tell our clients, let's start small. Let's do a pilot. Let's pick a topic, unmet need, burden, or maybe the patient voice, and maybe do a series of podcasts, a short video, and roll it out internally. And then if you're going to roll it out externally, Peter, we always want to get the end users feedback, right? If any kind of, if you're doing an app or any kind of digital platform you're using, you always want to test it with the end user to make sure that it's working. So that's how we work with our clients.
Okay. Just out of interest, and I don't want to go on my soapbox here, but metrics, we're talking digital activity. I mean, like, let's take the podcast example. What sort of issues you face on the metrics front? What are people asking for? What can you actually deliver? Would you agree that a lot of the time people aren't measuring and tracking and using that data properly, or am I being unreasonable in that sense.
Michelle, did you
Yeah,
write this
Michelle's our
question?
KPI expert.
You're talking about my favorite subject, Peter. Metrics, yeah. So in terms of assigning robust KPIs and metrics to these tactics, it's dead simple in terms of how you do it and how you can keep on top of it, because you can use Google Analytics, a software called Google Analytics that's free, that gives you real-time results on that. But also probably the more subtle type of metrics that we also look at capturing is that behavioral change and understanding it from a affiliate feedback point of view, but also from a user point of view. And that's something that's a little bit more difficult to do, and you have to think about it a little bit more in terms of how we do that. But what we like to do is we like to look at something called the hard metrics in terms of what the behavior is, what the person's actually doing, but then the softer one in terms of that less descriptive in terms of that perception measurement, in terms of what they're thinking and how it's impacting on them.
Just as a throwaway comment, because we could do another webinar on this. Indeed, we've got one coming up in a couple of weeks' time. But just as a throwaway comment, are you finding the clients are demanding more metrics?
Yeah, definitely.
So there's an element of you wanting to, there's an element of the client demanding it. So that is becoming more of an issue. Yeah. Okay. So I'm sorry, I cut across you, Sue. Were you trying to say something there? Sorry.
No, I'm just interested. Okay. There's a few questions coming in around the patient and the patient representative on the chat, which is great, because I think it is, we are passionate around value capturing the voice of the patient. Cost effectiveness and economics is one thing, but I think what we're really trying to tap into is how we can get that patient perspective much more reflected in that whole appraisal. And it's sometimes what we're finding now is that products do get approved, but there isn't the pull through, so the patients still aren't getting active access. So it's not even that it's being blocked maybe at a national level, but it's not being prioritized locally. And I do think that is where access more locally can be driven through some of those sort of patient advocacy. We've been asked around, can you do materials and tools to help that sort of value comms to that sort of patient advocacy group, so that they can go out and cascade. And I think so. I think from a market access perspective, we need to think about, maybe reimbursement is traditional, but actually human behavior about access to medicines is a little bit more softer, and I think that's probably the angle where some of the local countries can do more.
Again, this takes us away from the digital theme, but the patient thing is all pervading now. So, Jen, have you got any views from the States in terms of that? I mean, let's just finish on the sort of patient voice aspect of things, which could be digital, could not be, or could be a patient standing in front of a committee of people, let alone anything else. But just on that aspect of things, I mean, have you got a comment to finish on, Jen?
In the US, from a patient
in the US, from a US perspective, that's what I was wondering.
Yeah, definitely. As I mentioned, I was in the field for 8 years, and from my experience, when I was talking to a US payer, if they had a family member or a loved one that actually had the disease, the conversation was very different, right? They understood the pain points through the patient journey, and they understood the importance of this new product. So we are now seeing fewer face-to-face interactions with payers. Pharma can't get in as much, and especially, with just the lack of travel, there's just, limited interaction. So this is where I really see the patient voice becoming very valuable in a podcast, is because you are able to provide that information to a payer that they can listen to it, at their own time. As someone mentioned in the chat, it really makes it human. And, not all payers have had, loved ones who've had these different diseases, especially rare diseases, it's a very different conversation. And these patients go through such crazy journeys. And, we really need to bring that to life and help payers understand why we're bringing these products to the market, or why patients need to be able to access them.
Okay.
Can I just add one comment? There's a comment on the chat around that we're talking a lot about podcasts, and is this a US thing? And I, having looked at the survey, I was really surprised that the UK respondents were even more positive than the US ones about some of these. So that's not, I wasn't interviewed clearly, but it isn't just a US phenomenon. I think Germany at the moment was probably a little bit more negative in terms of that transformation, or I'm not going to say negative, actually not quite as up there on that. But certainly it wasn't just the US as an outlier. So for asking that question, thank you for that. I think countries are moving in different ways at different paces, and obviously in a small sample, it depends who you ask. But we did try and get a spread of people, and we definitely got some that were like, do you know what, COVID hasn't changed it. This is me. I want traditional, give me publications, but was much more than I expected. To be positive about sort of moving into that space. And this is talking about payers, it's not talking about affiliates. So I think there is appetite. I just think it is, maybe people that are more at that local payer level where they're trying to get their heads around new products coming into the market and things like that, having those types of media is useful. But
yeah, and just one quick question. Well, quick comment, excuse me, is, we work with, most of our clients are global clients that support the different affiliates. And we are seeing the podcast actually being used from a global perspective, not just a US perspective, from our client perspective.
Okay, the question, the title of this was the digital payer, fact or fiction. Michelle, come on, just in 30 seconds, what's your final comment before we wrap this up?
Of course, Peter, I think it's fact.
Darn well ought to be anyway.
No,
and we're working hard to make it so.
Yeah, no, I do think it's fact. And I also think that it's not just going to be only digital, as we've said, it's very much going to be a multi-channel approach. And one of the things that popped up in the chat that I was reading and the conversation and what you asked is that digital is all encompassing, and yes it is, but what we really want to do with our audience is walk before we can run. So therefore we're starting with more digestible formats in the form of short videos, podcasts, channels that they're engaging in. And I do think, as I said, it's going to be a very exciting time in terms of how this is going to accelerate and evolve.
Yeah, cool. Okay, and so say all of us. Okay, right, we are slightly over time as always. I actually would I've written down at least half a dozen titles of other webinars that we can do. Okay, guys, so I'll be back. Right, everybody, thank you very much. I'm going to wrap up now. Those of you who are watching us, please, you can just stick around, and we will keep talking to the top of the hour, okay? But for the purposes of the recording, I'm going to say thank you very much to the audience for joining in, but particularly to the panelists, thank you very, very much. And Jen, I know it's early in the morning out there, so thank you, thank you to you, okay? I know that I can say from all of your points of view, you're very happy for the audience members, the viewers of the video to contact you via LinkedIn and so on. I think some really interesting points that we've covered in there, so thank you very much. If anybody's watching this wondering what I do, medcommsnetworking.com is the place to go. There's loads of stuff happening, lots of resources and information. And if you like these sorts of webinars, we've got, as I say, hundreds of them recorded now on NetworkPharma TV, and there's more coming. We'll be meeting every week for the foreseeable future. So huge thank you to everybody. I'm just going to ask everybody to give us a little wave as I close it down and say stay safe. Okay, everybody. Bye bye then. Thank you.